Hi, I'm Pat Iyer, a legal nurse consultant who's been writing reports for attorneys since 1987, and I've proofread thousands of reports for legal nurse consultants. One of the things that I saw and continue to see in LNC reports is a tendency for lack of consistency. And what do I mean by that? I mean, when an LNC writes a date in a report, it should be in the same format throughout the report. March 3, 2023 can be spelled out in words, but it also can be written in numbers with either dashes or slashes between the numbers. Pick one system, stick to it. Use consistency when you're denoting time. If you're using a 12-hour clock, use AM and PM in capital letters, or A period M period, P period M period. There is no such abbreviation as and pub. It requires either capital letters or periods. I find that attorneys appreciate the 12-hour clock versus the 24-hour clock or military time because it's easier for them and it makes more sense to them. Use consistency in your font. Don't change fonts in the middle of the report. Don't change the size of your font in the middle of your report. Make it all consistent. Make all of the margins consistent or left justification. I recommend left justification over full justification because sometimes full justification stretches short lines and makes it really hard to read. Be sure that you are consistently using names. If the name of the plaintiff is John Jason, don't refer to him as John Jason or Mr. Jason or John. Always use the same way of denoting that defendant, as well as identifying people who are defendants in the case who might be nurses and physicians, or use the same name for the plaintiff. It is a mark of respect in the legal world that you will refer to the plaintiff as Mr. Jason, as opposed to the more familiar John, unless the patient is a child, and then it would be appropriate to talk about Sean or Taylor or Deborah. Some of the first names are appropriate when you're talking about a child. Barbara, is there anything that you would like to add about consistency in a report?
Yes, I'd also like to suggest if you are speaking about somebody that is a professional, such as a physician, don't refer to them by their first name, refer to him as Dr. Smith, and being consistent throughout there, because you shouldn't have just using their name John versus their professional title of Dr. Smith. It's important to show respect, as Pat has mentioned.
And then along with consistency, if it's Dr. Smith, don't have another reference to that person as Susan Smith, MD. Just be consistent in how you are denoting that individual in the report.
Thank you for bringing that forth. We'd like to invite all of you to our 7th virtual Legal Nurse Success Conference. And this will be held March 23, 24, 25, 2023. You will hear so much more about this topic, as well as others, during this conference time, which Pat is going to talk about.
The conference consists of speakers who are designed and picked by Barbara and I to motivate you, educate you, and inspire you to think about the ways that you can manage your legal nurse consulting business in a clearer way, in a broader way, a more concentrated way for business growth. We've got speakers who are attorneys, who are business experts, and experienced legal nurse consultants sharing their perspectives on what has helped to make them successful and giving you tips that you can use in your own business. Our topics range from a nurse killer, Charles Cullen, whose case I worked on with one of the prosecutors, to a man who accidentally electrocuted himself and required the skill of a plaintiff attorney to help settle his case for an amount of money that was extraordinary, for damages that were extraordinary, along with his legal nurse consultant, Nancy Stuck, who is an expert fact witness, to summarize the voluminous medical records that this man has generated. Barbara will be teaming up with Joe Flores, who is a nurse and an attorney, a nurse practitioner, to talk about the Board of Nursing and its role in the legal nurse consulting world and how we can interface with what the Board of Nursing is doing. We'll talk about business topics such as creating systems to benefit you by building a list of people who visit your website, getting referrals from people, knowing how to frame your marketing message in a way that will be appealing to people. So many topics that we have put into a 3-day program for you that is available March 23, 24, and 25, 2023. The link is right below this video. It is lnc.tips/March 2023 virtual. We would love to have you come and join us and meet your colleagues. Give yourself the gift of learning and inspiration by making an investment in the conference.
Make the investment in yourself, and we look forward to seeing you.